Good evening, everybody. We are live on YouTube. We wanted to thank you, everybody, for joining us tonight. My name is Isabel Germano. I am the chair of the NNS CNS section on tumors, and it is my great pleasure to host you all tonight for this webinar that is really focused on trying to have a better understanding of what neurosurgical oncology is all about, and in particular, what the Neurosurgery Oncology Fellowship is. I would like to first introduce Annalise Rodriguez, who is the co-chair of the Education Committee within the Executive Committee of the Section on Tumor, who had the brilliant idea to prepare this series of seminars. She will be the moderator tonight, and she will be introducing the speakers. Annalise, thank you.
Thank you so much, Dr. Germano. Well, I am happy to be here and happy for the speakers to join us tonight. I am part of the Education Committee, and we just want to have a programming for people along the continuum of becoming neurosurgical oncologists. So we thought that this would be very appropriate. Furthermore, there have been recent changes in the application process to make it more fair and equitable. And there have been also a lot of more programs that have gotten CAST accreditation. So we wanted to be sure to highlight programs from all over the nation. So Dr. Zachariah and I are going to be the moderators, and I will go ahead and present our first person, which is Dr. Chu from Cedars-Sinai, and he's going to talk about his program.
Great. Thanks for the opportunity to speak. Our neurosurgical oncology director is really John Yu. I look like I could be a John Yu, but I'm not. And I know this is for fellowship, but the slides that I have that are really easy and convenient are things we use for residency. So this is a little bit what the hospital looks like. Our chair is Keith Black. We have a residency program that we try to make sure it doesn't interfere with the fellowship. So, you know, there's many times when we have this idea of whether who gets priority on cases. And so the way we try to settle that is that we actually have two different services. We have essentially a cranial service and a chief for that, and a spine service and a chief for that. So it's not like you're fighting with multiple chief residents for cases. The goal is to get you independent operating time, of course, but there may be times you're taking a junior through a case because that's the way this kind of world works. Our brain tumor program faculty cover a fair amount of different things, from gliomas to skull base, and one of our faculty does more endonasal surgeries than other things. We have a fair amount of what we think is a good surgical training for this fellowship. And it may be things that you've seen before. It may be things that you have a certain way you know how to do things. But the whole idea is to kind of glean off little tidbits from different ways to approach a problem. There are often multiple ways to approach a problem. And we do have a pediatric neurosurgeon in some pediatric cases, although it's not really the strongest pediatric neurosurgery experience compared to like LA Children's down the street. In the fellows we've had in the past, one of them did only about 200 cases, but we think he just wasn't super motivated. Someone did 335. Someone did almost 400 cases. We do think we get some good experience for you there. There is some research experience, and John Yu is one of the translational research neurosurgeons here who has a lab. But obviously, for this one-year fellowship, and if it's part-time clinical, there isn't really a ton of lab time. We actually do have a future fellow who is electing to do some lab time for a year and some clinical time for a year after that. So that is that kind of option if someone is interested, but that really kind of summarizes our program a little bit.
Well, thank you so much.
Thank you.
We're going to go to the next program.
Great to be here tonight. Thanks everybody for participating. I apologize, I'm not on video. I'm doing double duty here at a Halloween parade with my daughter. But I'm going to introduce Ashish Shah from representing the University of Miami program. As many know, a very busy program, so interested to hear his take on the fellowship.
Great. Thank you so much for having me. I think starting from the back here with my slides, I'll go back in time. Sorry about that. Okay, so thank you for having me. I'm one of the junior faculty at University of Miami. I'm kind of stepping in for my senior partners, Rick Komatar and Michael Ivan, who kind of lead the program. I'm a kind of Miami thoroughbred. I've been training there since I was in medical school, undergrad, residency, and second year of faculty right now. And I'd love to share our thoughts about our University of Miami Surgical Neuro-Oncology Fellowship, which I think is a great fellowship and a fun fellowship for those interested in brain tumors. We have a pretty robust faculty that covers the wide breadth of neuro-oncology. Rick Komatar is really well known as our senior faculty, focuses mostly on all kinds of brain tumors, including skull-based pituitaries, gliomas. Mike Ivan and Carolina Benjamin lead up our skull-base and radiosurgery aspects, along with Howard Landy and Ron Benveniste. And I focus mostly on malignant gliomas from a translational standpoint. So our program, is quite diverse. And over the last, really 10 years, our volume has really increased quite significantly to the point where we're doing 1,200 brain tumors per year here. And a lot of that's attributed to the fact that the state of Florida population is really concentrated down here in South Florida, from West Palm Beach, Broward, and Miami-Dade. And we're fortunate that we're the only academic medical center south of Tampa. So we capture a lot of volume in this tri-county area, and this really helps us develop a surgical expertise in neuro-oncology. Part of that is, building up a brain tumor biobank and collecting specimens prospectively, so that if you have ideas during fellowship for research projects, you can access them readily without having to go through lengthy IRB processes, because that infrastructure is already there. And any brain tumor program, and every program here that's presenting today has a really comprehensive brain tumor program with high volume and cutting edge techniques, and it's really important that you have access to a wide breadth of neuroradiation oncologists, neuro-oncologists who can kind of guide you through not only the surgical decision making, but also the medical and radiation decision making as well. So a part of our fellowship is also kind of integrating yourself into research, clinical research and translational as well. And so we're proud that our fellows are able to publish quite a few papers. I think the last year's fellow was publishing around 10 to 15 papers last year. So that was quite nice for us. Important things as well as a neurosurgeon, especially if you're going to neuro-oncology, is being able to participate in phase 1 and phase 2 trials. We have several phase 1 and phase 2 trials starting here at the University of Miami that our fellows are going to enroll in and be involved in from the start to finish, which is nice. This can range from using laser ablation with combination therapy, or viral-based gene therapy techniques, to surgical guided resections using MR spectroscopy and Raman histology. Aside from the surgical clinical trials, there's a lot of medical clinical trials as well that we'll be exposed to as well during training. From a surgical standpoint, being able to access just the wide breadth of neurosurgical techniques, from awake craniotomies, using advanced neuronavigation, advanced endoscopy, laser ablation, and biologic therapies intraoperatively are all really important to be able to do. I think having a paradigm to do awake craniotomies is very important, and all of our fellows feel very comfortable doing awakes by the end of our fellowship. Laser ablation is a big mainstay of our treatment at Miami, and so a lot of our fellows are real well versed in ablating a variety of tumors for a variety of indications. We integrate Raman histology into our workflow. This is a video from Mike Ivan. He's a big fan of augmented reality. So he tries to integrate this into his tumor practice. For those interested in AR, I'm not an AR buff, but some people love it. So good to integrate that into your workflow as well. This is just some more work on the connectome. And then, kind of the research aspect is very hard to kind of be involved from a basic translational aspect during 1 year fellowship, but all of our faculty are very kind of integrated into our program to kind of get you involved in their projects and collecting specimens. And if you have ideas for K awards, this is kind of the idea where we kind of mentor you, get preliminary data, and kind of work with you on developing your specific aims for the future. So These are just a few things that I think are really important that are unique to our program. If you need protected research time to kind of get things done, we're flexible trying to arrange that time. We have K Award grant writing workshops and workshops that develop your specific aims. Basic science support. So, if you need preliminary data for a specific project you have in mind, our labs can help, generate some of that preliminary data to help you out. And clinical trial design course is really instrumental as well from our cancer center. So these are a few things that, our fellows have access to. And I think, beyond that, it's really fun to be in Miami in the winter. It's beautiful weather, and I think you'll have fun here. So thanks again. Come visit. Here's my email address, and Mike Ivan, who's the program director, is always willing to take a phone call or whatever you need.
Well, thank you.
Yeah, great summary.
So our next speaker is Dr. Newman from Sloan Kettering.
All right. Thank you very much. And I'll share my screen. Give me 1 second. There you go. Can you see my screen okay?
Yeah, it looks great.
Perfect. All right. So I'm Chris Newman. I'm from Sloan Kettering, and thanks for having me tonight. And, good talks by everyone else kind of saying a lot of what their fellowship programs offer. And I think we offer a lot of similar things, some different things, and I'll do kind of a whirlwind course through those and also talk kind of about our two differentiated pathways for fellowships at Sloan. So from that standpoint, the overview of our fellowship, it's a 12-month fellowship, it's a single year. It's mostly offered for postgraduate, so PGY 8 residents with some rare exceptions. And we have 2 tracks. One is a cranial track, and that track takes 2 fellows in any given year. And then there's a spine oncology track that takes a single fellow for the year. And I'll break those down a little bit more later on to give you kind of some of the nitty-gritty of the things that I think are kind of the day-to-day quality of life stuff. We are a program that you do take home call on a Q4 basis during the week, so once a week, and then weekend call once a month. The upside to this is that you really start to get to see the pathology here and start to do some of the decision making with the attendings that are on call. And the call isn't onerous because there's not a level 1 trauma center. We only see things that come in through the urgent care, so it's all cancer-based call. And the call is shared with the Cornell residents, the junior residents, and the chief residents. And when it comes to vacation, it's 3 weeks. I feel like it's very standard, but then it's a very flexible schedule for interview dates. With having 3 fellows and a chief on service, it's really easy to get away to actually take your interviews. We've had no issues with that. And then from a housing standpoint, it's subsidized housing. So despite the high rent prices in New York, we actually do help you from that end. And having lived in that housing, it's not bad. It's honestly not bad. And when it comes to call, the call has an attending who's on with you. And so that's who you're going to call and staff things with. If something goes to the operating room, they'll be there with you to do those things. And so it's not kind of scut work call, but it really is about trying to learn how to manage these people, these patients and their acute issues that come up. And so if we start with the cranial oncology fellowship, this is 11 months on the cranial service with 1 month on the spine oncology service, which we've liked that model because it still gives people exposure to spine oncology, as a lot of people don't get to see a lot of that during training. And we switched recently to an apprenticeship model for the cranial fellowship. And what that means is that you spend 2 months at a time with our different attendings. So they have different kind of niches or specialties within themselves. Dr. DeBar, who's the chair, has a little bit of a focus on skull-based pathologies. Dr. Brennan has a little bit of a specialty in some acoustics, and Dr. Moss has a bigger brain metastasis imprint. And then Kenny Yu has a little bit of a combo of a heavy basic science imprint, but then also some glioma. And then they all have a little bit of a coverage of glioma and metastases that pop in, but it gives you a good smattering of those things. And then with that half day of clinic that you'll do with kind of your assigned attending for that time, you'll also have a half day of academic time. And there's a lot of weekly tumor boards that can really help you to think through the process. And I think the goal of the Sloan Kettering Fellowship really is not about teaching you how to do a simple craniotomy or even the awakes that we do. It really is about teaching you how to think. You're going to operate a lot, but it's teaching you how to think through the problem of who to operate on and why. And when it comes to some of the things that we do, I think a lot of our programs are offering these things in terms of how to do awake craniotomies, lit and laser interstitial thermal therapy. We do a lot of brachytherapy cases, 5-ALA, the endoscopic and nasal approaches, acoustics, a lot of intraoperative MRI cases. We have an MRIS in one of the ORs that's dedicated for that, and a lot of stereotactic radiosurgical planning. And I think the big thing is you're going to get exposed to everything, and integrated into all of this are the clinical trials that are constantly ongoing, whether it be drug delivery trials that are directly implanting drug, or if it's doing metastasis resection to look at the actual concentrations of drugs from the newer agents, you're going to be able to get involved in those things and participate in them. And I think that's a really meaningful thing. But I think even more important are all kind of the multidisciplinary conferences that we have. This is a list of them, and it's not necessarily all of them, but these are the main ones that people do go to and attend. And you don't have to attend every single one, but there's a lot to be learned. And especially when you're kind of in the apprenticeship model, it can be nice to go to your attendings tumor board and actually present. And I think that presenting is what you get the most out of with doing. And so the brain tumor board focuses a lot on primary neoplasms, whereas the brain metastasis board obviously is more metastases. And then with the radiosurgery tumor board, it's not just a tumor board, but it's also going to be contour planning and review, so you can get some exposure to radiosurgery from that end. You can see the rest of the list of a smattering of things here. Switching gears to the Spine Oncology Fellowship, that's myself, Mark Bilski, and Ori Barzilai. And it's a 10-month, it's a 1-year fellowship, but then you do 10 months on the spine service, and you switch over to 2 months on the cranial oncology service. And that's really to let the cranial fellows get some exposure to the spine side of things, but then also to give you some time where if you don't want to necessarily do the cranial, you can also do things like spending some more time with the radiation oncologist or finding kind of other elective things to do during that time. And our weeks are pretty simple. It's a weekly day of clinic. We run ORs standard. The elective ORs are Tuesday through Friday. We add on Mondays when necessary. And with the Spine Radiosurgery Conference, I think it's a really great thing that everyone who is a fellow should participate in, because it really does get into the nitty gritty of how you actually do spine contour planning, how you think about adjacent marrow spaces, and a lot of things that I don't think are taught very well in residency, or at least not when I was in residency, and that are really helpful when you get out to actually be able to speak the radiation oncologist language and kind of check those contours. And then we have a multidisciplinary spine tumor board that's every Thursday morning before the OR. It's well attended, and it's a combination of the spine neurosurgeons, the radiation oncologist, the radiologist, the pain specialist, the physiatrist. Everybody kind of comes, and medical oncologists come, and we actually talk through complex patients and try to create plans. And it's a great learning experience that I enjoyed when I was a fellow. When it comes to the cases that we're doing, I think the operative experience is great from a spine oncology standpoint. It's a lot of open and MIS separation surgery. This is the home of separation surgery. And so we do a lot of that on a weekly basis. We try to be as minimal as possible with percutaneous when appropriate, but open when we need to. And I think a really big and awesome thing that my partner Ori Barzilai is doing is actual true robotic surgery. So it's not using a Globus or a Medtronic robot that's holding the actual screw, but truly using the Da Vinci to resect kind of large anterior schwannomas. That's a paper that's coming out soon. But really sitting at the robot and working in conjunction with our other surgical oncology colleagues to kind of do minimally invasive approaches for very large tumors that traditionally would be large anterior transthoracic or other approaches with high morbidity, but instead getting people out in the next day or same day in some cases now. And then we do have a robust neuromodulation center for the pain side of it, whether it's pumps, stimulators, percutaneous cordotomy, or even myelotomies. And then we don't do a lot of pediatrics, but we do help out the pediatric service with the neuroblastoma population in particular, for dissecting out nerve roots for things that involve the brachial plexus or thoracic and even lumbar nerve roots. And there really is a good chance to get involved with radiation treatment planning and really get a mastery of that. I think if you take the time during this fellowship, you really can come out understanding the full breadth of spine oncology. When it comes down to cases, in 2022, it's about 939 total cases that year. That's excluding any radiation-based cases, purely things that went to the operating room, with about 560 cranial tumors, and the spine side being 321, with a heavy predominance of that being separation surgery, more than 80% of that. And I think the big thing to talk about too is jobs. And so if we look at where our previous fellows have gone, this is kind of a list of where all of our previous fellows have gone. And I think it kind of speaks to the fact that people have gone everywhere. It's a fellowship that you come out of well-trained, you know how to actually talk with the radiation oncology colleagues and medical oncologists, you speak their language, and I think it really sets you up well for the next steps. When it comes to additional things that you can do, for people who are interested in the Sloan Kettering Fellowship, there's also an optional 1 or 2 years of basic science research that you can do beforehand. Kenny Yu, who's currently faculty, he actually, before his fellowship year, did, I believe, 1 year, possibly 2 of dedicated basic science research time in one of the labs, and then did a fellowship year and then transitioned to being faculty with a heavy basic science footprint. And so people have done that in the past, and I think I've found it very meaningful because there is a world-renowned set of laboratories you can work in, both in the neurosurgery service side of things, but also at the Sloan Kettering Institute, with a lot of world-renowned researchers. And then from an institutional standpoint, you can get certificates in clinical trials and design. Our fellow last year did that. There's a lot of educational series offered by the Graduate Medical Education Office, be it contract negotiation, how to deal with litigation, and other professional development stuff. And the medical librarians and the statisticians are amazing. We have statisticians associated with the department who will do statistical analyses for your retrospective data polls and research. So that kind of takes away a little bit of the onus on that. And the medical librarians are also helpful in terms of finding grants and other stuff. And you can also spend some elective time with radiation oncology if you so choose. And the last kind of all I'll say about the fellowship, there's a ton more I could say, but I don't want to go too far over my 10-minute allotment. If you want to look at the application, the little QR codes here will take you to it. But I think one of the biggest selling points beyond being a really great fellowship, and I'm biased as a product of it and now an employee of it, really is that you get to be in New York for a year. And these are just a smattering of photos of New York and the Met, and everything you can see in the city. And so with that, I will stop and give up my screen.
Thank you so much. So just a reminder to the participants, feel free to enter questions into the chat. I'm going to just ask, because now for the CAST accredited fellowships, we're doing more of a formal match process. And I just wanted to ask each person, what are you looking for in an applicant? Like, who is a good fit? And maybe just speak about that for each program.
I guess I'll help answer. So I think, I think we're looking for applicants who are very, obviously interested in our program, but interested in becoming academic, neurosurgical oncologists, those who really want to push the field forward. Mostly, I think everybody applying for, fellowships, postgraduate are mostly interested in going to academics. And I think those are the applicants we really like to interview. And beyond that, I think just in the fellowship, we're very close to our fellows. We do cases hand in hand, and we rely on them. So obviously, someone who's a team player is really important to us as well.
Yeah, I guess I'll go next. I'd say from our end, we're looking for someone who, has academic interest, but if someone wants to go with a private route or work in a rural community or, a different setting, we're open to it. I think that there's a meaningful sense of dissemination of the message of how to provide quality oncologic care that we also recognize as being a meaningful contribution to neurosurgery. But I think more than kind of the where you want to go, I think the bigger thing is being curious and committed to asking questions and providing good quality care. Because the biggest thing I would say that when you come to Sloan is that there's an abundance of opportunities and it's impossible to take advantage of all of them. And so the person who gets the most out of the year here is someone who really wants to find the interesting courses, do the extra things, and really put in that time. And we want that person. You also want to be a good team player because they are working with the residents and finding ways of sharing. They are splitting cases and kind of having discussions about what things they want to cover. And so I think, having a good team player is also really important. But it's really just that curiosity and that drive to learn more and maximize the opportunities, because it's a great year if you do that.
Well, those are all such great answers. Not sure I have something better to say, but yes, for us too, we're very open to multiple ways that people contribute to neurosurgical oncology in the future. We've had someone go out to start a brain tumor program, so obviously it can't be the most academic translational thing in the beginning. And we have one fellow who wants to return to Saudi and bring some of these newer surgical things to that country. So there are lots of ways to participate and to give to that kind of academic mindset, but it's not always like a pure super academic kind of job that we spur people onto. It's nice to stay in touch with the fellows. We have some who still kind of run some cases by us here and there. That's one of the things that's great about having this opportunity to train people.
Yeah, appreciate that from everyone. We have a question from the audience who had asked about opportunities for international neurosurgical graduates. Again, this is probably an institution-specific question, but curious if any of you have had international graduates and what your policy is and maybe how they could make themselves competitive or get more information.
I can start with that. So we have had international graduates. Kenny Yu, who actually is currently faculty, was an international graduate. He was from England, and so he came over. The biggest barrier to that with us really is just whether or not your visa status allows us to hire you. And we kind of, it's a year-to-year thing of as things change over time and as politics change, what visas we can actually work with does change over time. So I think it's something where it's a year-to-year thing, but we are open to international students or international people who have international backgrounds and training, provided that the visa status allows us to actually employ you and bring you in. And even our current spine oncology fellow is the same boat. And so it's not a barrier for us as long as we can actually get through the paperwork. But on an individual basis, we will, like, as you apply, we can look at that. And if it's something that we can't work with, we will let you know up front.
Yeah, that's great. I gather that's probably similar for each institution, but Ashish, any other thoughts on that?
Yeah, I think we have a very similar policy. I think we've had a Canadian fellow before, and we've interviewed a lot of international medical graduates from Spain and England as well. And I think the visa thing is a big one, and making sure obviously we can get you credentialed in time for the start date, because that's usually what the main delay is kind of the credentialing process. Get you over by July and then get you so you're at least ready to operate and get everything going. So, but yeah, definitely that is on the table. We've I think in our other specialties like trauma, functional, skull based, they've had a lot of international fellows, and so it's definitely feasible.
Yeah, that makes sense. We've had a Canadian fellow and have another one coming. The hardest thing is California Medical Board takes a long time of licenses. That gets tough, but.
Yeah, thanks for that. I think Dr. Germano has a question too, like that.
Yeah, I would like to say thank you for these great presentations. I typed in the chat the link to the Committee on Advanced Subspecialty Training that we refer to as CAST, so that the participants will have a way to check online which are the CAST approved fellowships, and all three speakers are part of CAST approved programs. And the reason why I think sometimes it's difficult for applicants to understand the nuances, because those that are part of the CAST, I think, are programs that are validated by peer reviewed. And so you as a fellow have the certainty that the minimum standards, and as you've heard tonight, well above the minimum, but the minimum standards are there. And therefore, if you train in those CAST approved programs, you will receive the training that the neurosurgical oncology community thinks is the minimum to function as an academic neurosurgical oncology and as a neurosurgical oncologist in practice. So again, very important to differentiate between those that are CAST approved and those that are not. My questions to the panelists is, you guys are in the neurosurgical oncology field. You have been for many years, you're trained. And I would like to hear from each of you what brought you into the field and what is retaining you to be a neurosurgical oncologist as opposed to be vascular or trauma or any of the other exciting neurosurgery subspecialties.
I'll go first on that one, I guess. So as a recovering brain specialist and currently a spine surgeon or a spine oncologist, I'll say what got me into this field was just having in med school interesting experiences with cancer patients and just seeing the good and the bad of the hard conversations that come with that. And that kind of got me interested in it. And then having really good mentors, one of whom was like a former Sloan Kettering fellow in Nduka Moncalor, who was at Pitt for a while when I was there, who kind of shepherded me through and showed me kind of the beauty of taking care of this complicated group of patients, and how multidisciplinary and really a team approach it takes to get there. And I think that's what got me into this. It's just, you're all in for a patient and you're having these hard, real conversations, and it's a beautiful thing, but also a very hard thing. And I like that challenge. It's an evolving field. It's a field where we're still learning so much and we're still just trying to get control over diseases. And I think it's an exciting field. There's so much that's happening. I think that's what got me into it. But what keeps me in it, I think, is just the ability to have fellows every year. Like I love teaching, I love assisting with running the fellowship program. I think that the really, really bright people that every year come through, ask challenging questions, push me to think about what I'm doing, push me to do research to change the way that we look at spinal oncology to be more minimally invasive. I think it's really the fellows that we get every year that keep me engaged because they keep it fresh and they bring ideas from completely different places who look at the problem totally different. And that growth that I get from them keeps me here.
Yeah, I lost it that. No, I'm just kidding. So, I mean, who doesn't find the brain fascinating? But also, brain tumor is really one of the last bastions of microsurgery, right? We're not clipping as many aneurysms as we used to be. Even in the time that I've been at Cedars, we clip less aneurysms than we used to. But right now, at least, we still need brain tumor surgery. I mean, there's one of these days where someone in this Zoom might, fix that problem that we don't need to operate on every single glioma. But for now, we do. So I think that's what part of it keeps it interesting and exciting. And then once you develop a bit of a skill set, it becomes this thing of like other people don't want to do these big resections, and that's something that's pretty straightforward for you once you do enough.
I'll echo all of my co-panelists' comments. I think being a brain tumor surgeon is the best thing in neurosurgery, in my opinion. It's fun. The cases are fun. You're they're interactive. You make a difference in the patient's lives. The real reason I got into it in brain tumor surgery and neuro-oncology is basically the science was very fascinating to me, and there were such big leaps and things that we can do as surgeons, as neurosurgeon scientists, that we can make a difference kind of in the outcomes of these patients. And because of that big gap, I was really kind of called to this field, and I'm glad to be a part of it. I'll say that one thing that is kind of is not talked about enough, I think, in the brain tumor fellowship kind of programs in general, is it's very difficult sometimes to find a job in neuro-oncology. There's if you think about a niche of saying I'm only going to do brain tumors at X and Y Z center, most neurosurgeons want to do brain tumors. If you go around in Florida, just in every hospital, everybody wants to do a glioma, and do a craniotomy and take out, and do a resection. And usually, we get sent to patients, after a biopsy or after a subtotal resection, or even a gross total resection. So I think it's tough to kind of find a niche. And I think it's really important as fellowship directors and as faculty and programs to kind of help our trainees find opportunities for them where they'll thrive and succeed as neurosurgical oncologists. So I don't know, maybe the other panelists can talk about how it's been for them, kind of finding jobs for their trainees and things like that. I know it's tough every year, and every year is a different thing, but I always find that a conversation that's interesting to have.
Yeah, I mean, I agree with you. It's totally tough, and I think it's getting tougher and more competitive. And I think having things like the fellowships that we all are offering kind of do help give people an edge, because it is saying that you've dedicated the extra time, and it's an extra set of people who really are experts in the field vouching for your skills and your capabilities. And I think that with brain, it's increasingly getting harder. So I think it is becoming more of an important thing to have. From a spine oncology standpoint, I think it's something where that field is still very wide open, because there aren't as many spine oncology dedicated fellowships. There are no CAS accredited spine oncology fellowships as far as I'm aware. But from that standpoint, it is something that is a very unique skill set that it adds, because a lot of hospitals are trying to grow a cancer center, and having someone who can deal with spine oncology problems is a big part of it. And so I think we've had a lot in the last few years, a lot easier time placing people in those types of jobs. But I assume that that'll get increasingly competitive as well. But having that network that the oncology fellowship opens you up to, I think is a big part of it. And that slide where I showed you, where everyone is working, that's kind of the network that you inherit of people who are associated with this program, people who know the quality that it produces, and people who you can reach out to. And so I think that's a big helpful part of it.
Yeah, I wish I had more magic answers of job placement, but it is a tricky thing, and it is a randomness of that year. Who happens to know who and who's got a spot and stuff like that. It gets a little tricky, but right, hopefully the fellowship prepares you very well.
Yeah, I think you made a great comment there that, a big part of a fellowship is just expanding your network. I think, there are probably a handful of people who aren't sure whether they want to do a fellowship, maybe feel they've had the appropriate clinical experience and aren't sure what a fellowship could add. But I think the three of you have made a really compelling argument for kind of not only what you offer from a clinical standpoint, but a lot of the intangibles that expanding your network can provide. So
Yeah, like everywhere you go, someone's a part of your network. Like Brad's a part of my network, technically.
That's true.
I guess I wanted to ask another question about in terms of mentorship. So I know that they're different. It sounds like slightly different models, but it sounded like a couple of programs had formalized mentorship opportunities, and just to talk a little bit about that, like how that pairing happens. Is it something that a fellow has to seek out, or is it something that a match is made early in the year? Just a little bit more about the mentorship that occurs.
Cool. I'll just jump on it. So for at least for like the Sloan Kettering model, so I switched the model of fellowship this year. So when I was a fellow, it was just kind of you kind of went from room to room, or from person to person each different day. And so the thing that we started with this year was actually pairing you with people kind of every 2 months. So you'll spend 2 months with Dr. Tabar, 2 months with Dr. Brennan, 2 months with Dr. Moss, and so on. And then for the last set of months, you kind of can gravitate toward, you can work with people that you gravitate towards, with the idea being that by giving you kind of the assigned formal time, it's 2 months where you're in that person's clinic, you're seeing their follow-up, you're not just kind of gaining that longitudinal exposure, you're also really getting to know them. And so for people that you do kind of naturally gravitate towards, it helps to kind of facilitate that mentorship bond, and then you can maintain that throughout the rest of the year. But that's how we've kind of tackled that, and trying to formalize it a little bit without pushing people onto people.
I like that idea. Maybe we should steal that fellow from John here for 2 months and see what he says.
There you go.
Yeah, our mentorship is a little bit more informal. I think all of our fellows kind of work with all of the attendings and, cover the cases. And, obviously split the cases with the chief resident, who's on the service at the time. But, for example, there are some fellows who are very interested in skull base and, microsurgery. So they work a lot closely with Mike Ivan, Carolina Benjamin. Some of our, I'd say all of our fellows are interested in building a brain tumor practice, and they work a lot with Rick Komatar and kind of developing how he's developed his practice, how to reach out to primary care physicians, and really that practice building and kind of the going through all the cases with them. And there's a few fellows who are interested in kind of basic translational work, and they come to my lab and lab meetings and kind of discuss how to write grants, things like that. So I think it's more of an informal process and really dependent on the fellows and what their interests are for the future. For example, someone who's not interested in having a lab at all, there's no really benefit to coming to my lab meeting. So so I think mentorship is something that's unique, and I think it's nice when it comes naturally.
Well, I will go ahead and thank everyone, and this will be posted on the YouTube, so you can obviously, if you attended live or if you want to share with others, this can be, even later tonight you can share. And then in closing, this is just the first of a series. So Dr. Zachariah and I are actually already reaching out to the next group, and it will likely be in November. And so look out for some more programs, and thank you everyone for all your time. And that was really great. It makes me want to think about doing another fellowship, but I think for now I'm good. But if I had an opportunity, I definitely thought this was really inspiring. So thank you.
Yeah, this is great. Appreciate everybody's input.
Thank you very much for participating. I'm going to share my screen and just show you the link. I don't think it was able to go on the YouTube, so I'm going to spend a second or so with this so people can take pictures. And then the next second is, again, reminding us of the great group that joined us tonight and the great leadership from Dr. Rodriguez and Dr. Zachariah. And we're looking at more of these gatherings. Thank you, everybody.
Yeah, have a great night, everyone. Appreciate it again.
Thanks again.
Thanks.